Welcome back. While it's still too early to say how severely Omicron may affect COVID-19 patients, early data has been very interesting. The South African Medical Research Council released preliminary findings from the first 2 weeks of the Omicron wave, so to speak, in Tshwane, where the outbreak began. Let's unpack this data further with Dr. Abdullah from the South African Medical Research Council. Thanks for your time, Doctor. So early indications of less severe disease but high infection rates among the youth. Unpack this for us.
Shahan, good evening. A couple of things. One is that the age profile of patients in the hospital over the last 2 weeks is a different age profile. So 80% of the patients in the wards, in the COVID wards, are below the age of 50. Secondly, the length of stay of these patients in the hospital is lower. And thirdly, and the most important thing that we've seen, which is different from previous waves, is that the majority of patients are not dependent on oxygen supplementation. This is what triggered my report. I walked into the ward on Sunday, what was that, the 27th of November, and was pleasantly surprised to see that the majority of patients were not on oxygen. That's quite unusual. In previous waves, you walk into a ward and 95% of the patients are short of breath, they're gasping, they're on oxygen, they need different degrees of oxygen. So that's the first impression we have.
Yeah. So do you think it's because of vaccination or immunity, or can you link it directly to Omicron being less severe?
Yeah, so severity, we're starting to understand that it means different things, right? So the first thing is, compared to all of the people who become infected with the virus, are there fewer hospital admissions? And as I've said in the report, it's too early to say. Because what normally happens in the COVID ward at the beginning is that, we doctors are a little more forgiving. So we'll admit more patients with mild disease because we have the beds vaccinated. But there's also likely a role that people who have had previous infection have got some kind of natural immunity, and that might be playing a role in this kind of lower rate of severe disease or lower rate of hospital admissions.
Yeah, get you. Also looking at the research you conducted in Tshwane, I was listening to interviews done this weekend, and many doctors are pointing out that people come in for different procedures and then it's picked up that they have the COVID-19 virus. They don't necessarily come in because it's a COVID-19 related illness. Did you find that as well?
Yeah, so that's exactly what's going on here. We found that most of the patients in the COVID ward are in the hospital for another medical, surgical or obstetric reason. And it's hospital policy that every patient gets tested for COVID. So if there's a lot of infection in the community, then the hospital patients are a subgroup, right? So there's more infection. But it's different from previous waves, and that's the point, we really want to emphasize, is that there are more people with incidental COVID this time around than in previous waves.
Yeah, and then just in terms of those who are admitted for COVID-19, are you seeing many of them unvaccinated or vaccinated during what you looked at in Tshwane?
Shahan, I watch you every night on TV. I knew you were going to ask me that question. So I can tell you that on the snapshot that I did on one day of 42 patients, 9 patients had this classical COVID pneumonia. All 9 patients were unvaccinated. So that's a really important finding. The numbers are small, but that's a convincing number. All 9 were unvaccinated. So vaccinations are protective. There's no doubt in our mind, about that.
Yeah. So, Doctor, since you watch the show, another question is me asking all of the experts to reassure South Africans about the effectiveness of vaccines, because I think they need to hear it from different voices, especially for those who might be skeptical tonight.
Yeah, I'm not an expert on vaccinations, you know. Professor Muddy, Professor Gray, they're on your show often. They have answered those questions repeatedly, but I'm happy to say that from our point of view, with Omicron, it it looks likely that even vaccinated people will get infection, but that infection will be mild, and both the Pfizer and J&J vaccines, are protective for severe disease. There's no reason to believe that there'll be any difference with the Omicron strain, with the Omicron variant. So vaccination is still our only serious protection against it. And if we had a higher rate of vaccination, we'll see even fewer admissions. So I don't think we must for a moment think that our hospitals are not going to be overwhelmed. They will be, because remember, in past waves, a lot of people couldn't get a hospital bed. And so if we have fewer admissions in this wave, I can tell you those beds that become available are going to be rapidly taken up by those people who couldn't get a hospital bed before. So we should still prepare for a rough time in this fourth wave. We'll need all the resources, all the wherewithal, to manage the admissions that we will get.
All right. Thank you so much for your time. Thank you for watching the show. Appreciate it. Dr. Farid Abdullah from the South African Medical Research Council.